If you feel overwhelmed by the mountain of paperwork and charting that remain at the end of the day, if you feel pulled between finishing charts after hours and spending time with family, or if you feel like you can't fully recharge when you are away from work before you return for your next shift, I want you to know that you are not alone. I want to invite you to a free webinar that I'm hosting Wednesday, August 17th at 9:30 p.m. Eastern. I want you to be able to finish your charting at work by discovering the 3 P's of charting in medicine: the power for charting, the plan for charting, and number 3, the purpose of charting. In the webinar, I will cover all these things and get you some quick wins you can implement right away so that you can leave work sooner and be more present at home. I look forward to seeing many of you there. You can register at coaching.mededwell.com/purpose, and that link will be in the show notes. And now on to today's show. Welcome to the MedEdWell podcast, empowering physicians to get work done at work and then be able to reflect and choose what is important for both their life and medical practice. I'm your host, Dr. Ryan Stejink, general pediatrician and life coach for physicians. Hello, everyone, and welcome to another episode of the MedEdWell podcast, where physicians come to be encouraged and equipped to take the next step in their own wellness journey. Thank you so much for subscribing and sharing these episodes and for engaging with these concepts. Today, I'm honored to have Dr. Audrey Wells as a guest. Dr. Wells is a sleep medicine physician and certified mindset coach on a mission to help people sleep better so they can feel more awake and alive all day long. She offers a group coaching program and private Facebook community for those struggling with sleep apnea and treatment, including CPAP. She also does individual coaching for those who want to uplevel their productivity and potential by taking too tired out of the equation. Dr. Wells, welcome to the show.
Thanks, Ryan. It's really nice to be here with you today.
So tell me a little bit about yourself and your journey to medicine.
Sure. Well, I guess I'll start by saying I was not one of those people that always knew they wanted to be a doctor. I actually dipped my toe in the field of research before I decided to go to medical school. And I guess I didn't like it so much. And so I decided to turn my attention to medicine. So I went to University of Michigan Medical School, decided to do a pediatrics residency, completed that, did a pediatric pulmonary fellowship, then sleep medicine fellowship, obesity medicine fellowship, and decided to stop at that point. So I'm triple board certified. And as you mentioned, I'm also a life coach. And it's just been really great to include all of those skills in my interactions with people who struggle with sleep problems.
Well, and just that continuous learning, and I'm sure some of those skills and curiosity from your research days have really translated well into how do I integrate all those things in caring for my patients.
Yeah, it does. And I think one of the great things about being a sleep medicine doctor is that because everybody sleeps, it's really starting from a place of common ground. Sometimes I say I wish I had $1 for everyone who wanted to talk to me once they found out what I do, because so many people have sleep problems. It's really pervasive in our society.
So how did you get interested in the field of sleep medicine?
You know, thinking back to medical school, I cannot remember any lectures or information about sleep. So I'm almost positive it wasn't there. But I do have a very clear memory of going to one of the ATS, American Thoracic Society conferences as a PEDS pulmonary fellow. And I was kind of bored in one of the all-day courses I was doing. I was ironically falling asleep in the course. It was still in the morning. And so I got up to walk around and I found another conference going on about sleep. And I read the board outside of the doors and just felt really connected to that material. Sleep is something that I've always kind of prioritized because I'm quite sensitive to sleep loss. And so I ended up going into that lecture hall that day and spent the rest of the day there kind of geeking out that this was something that I could actually pursue as a medical field. And so that kind of planted the seed. And later I was able to do the formal sleep medicine training and kind of solidify that as my career path.
That's so cool. And just how some of those things that you think, oh, what are the odds? I mean,
yeah,
it's just really cool, those opportunities that come up, and then just look back and see where it took you.
it felt like a revelation to me. I mean, it was very memorable experience. And so I think, being able to just kind of make that happen has been fantastic path for me. And I really feel like I'm in my element. I'm very passionate about these things. And so talking about it and promoting sleep as a pillar of health is something that I really am enthusiastic about.
Well, thanks for being here to share some of that. So when did you first notice that, you were particularly sensitive to sleep loss, or was that part of your time in training or some other experience you had?
I would say it probably started when I was a teenager. And I remember in high school just getting up in the middle of the night, feeling anxious, and I couldn't sleep. And anxiety is often something that keeps people from sleeping. And I certainly experienced that firsthand. In fact, on some of the worst nights, I remember my dad getting up with me to kind of talk things through and help me relax enough to go back to sleep. In medical school, I really struggled. And I want to kind of highlight this today because I think the culture of medicine sort of rewards taking sleep loss or productivity to extremes. And it's really detrimental to not only physical health, but mental health and learning as well. So, in med school and residency, when I was taking call and, studying late at night and trying to do all the things, oftentimes I would compress my sleep. And I'm sure you've had the same experience, right? So I'm not someone who has a high tolerance for that. It was quite clear to me that that would limit my career choices. For example, the emergency room is not for me. And surgical practices where, you're on call and having to stay up, it was not for me. And, I had to actively manage the rotations that I did with call involved so that I could catch up on my sleep and give myself enough time the next day so that I could function. And by function, I'm talking about just, doing the very best I could. I don't think that I was excelling during that time, to be honest. But on other rotations where I was able to have a normal or typical overnight sleep opportunity, I was doing fine. And so it really highlighted for me the fact that sleep is so critically important. And, other people I've talked to in my training and all the way up until yesterday, in fact, have sort of echoed those experiences.
Yeah, I think that it's so common. And even just looking back, I mean, some of those things, sometimes you have some wake up calls. I mean, I remember like having a micro sleep while I was driving home from my sub internship in medical school. And thankfully, I didn't change lanes and it was just a momentary thing, but it really scared me enough where when I knew I was driving, I would be doing the congested part of the commute through Chicago, doing a week of nights. I actually just stayed at the hospital.
Mm-hmm.
My week of sub-I nights, they had an extra call bed, and I was like, this is not going to work for me. So what signs should people be looking out for? It's like how it affects their productivity, their mood, to say, hey, this is actually really limiting me in a way that I need to start addressing it.
Yeah, I think that experience you had while driving is a big red flag. For me, that has happened too. I remember one time sitting at a light in a turning lane, and the light changed from red to green. And I didn't know what that meant. I couldn't remember what that change was. And I knew I was supposed to do something. I was sitting in my car. I think if anybody is having that kind of experience, of course, they are way past the point of being safe. And, it's kind of in people's awareness that one night of sleep loss is about the same as being drunk, having a blood alcohol level of 0.08 to zero point 0.1. I do want to say, though, that the difference between being sleep deprived and being drunk while you're driving is that when you're drunk, all of your reactions are slowed. So you're late to brake or you're late to turn. But when you have a microsleep behind the wheel, you don't react at all. And so, especially if you're driving at high speeds, then that accident that you have in your car could be catastrophic for you or for someone else. And that is a big difference between sleep loss and driving drunk. Now, I think there's probably an extension of that analogy that I could make, which is even just modest sleep deprivation. So we're talking, pulling your sleep habitually down to 6 hours a night, sometimes 4 hours a night. Even that probably has some equivalency with having a few drinks in you. And one thing about that is, people tend to explain it away. They have some compensatory behaviors and such. But I think becoming aware of some slip ups, a little bit slower to make connections, becoming more aware of what sleep deprivation looks like for you is really the first step to help yourself to advocate and correct that. I had an experience one time where I was charting at the end of a call shift. I remember trying to get done before rounds started and handoff. And this was just before the 80-hour work week limitation. So I was the unlucky cohort that went through as just before that was enacted. And I remember looking at the computer, the EMR, and there was an octopus coming out of the computer at me. So I was having dream intrusion while I was sitting there, and yet I could hear people around me. I could see people in my periphery walking by. So again, that is too late. And, I think if you're really wanting to kind of create a grade for yourself, you can assess your thinking, you can assess your physical performance, and kind of look at your creativity or your reasoning skills. And if you notice those are depressed, look at sleep deprivation as a potential cause.
Yeah, those are great things to really dig into and evaluate, because, I mean, it's so easy to think, oh, I've gotten by for these years of medical school or residency on 6 hours a night. And it's like, okay, that just because it's been a chronic thing, it's harder to notice, I think, sometimes.
Absolutely.
But it really does affect, your creativity, your analytical thinking skills. I remember I was post-call and rounding and just trying to write orders for the parenteral nutrition, and I couldn't do it. And the pharmacist was like, do you want me to do that for you? Yes, please, before I mess something up that's really important. So those are really helpful tips.
Yes. And, it's not just overnight call that affects people. I know that, to your point, a lot of folks will go to bed later and wake up earlier. Getting 6 hours of sleep a night seems to be kind of a threshold there. But one way to know that you're not getting enough sleep is to look at a time when you should be having peak awareness. For most people, that's going to be in the late morning, so around 10 to 11 a.m. And if you are feeling like you're still tired, you need a cup of coffee to function, or you're having yawning or feeling like you could take a nap, that's a really good indicator that you're not getting enough sleep overnight.
So if people are saying, yeah, that's me, what do you think that first step? There's certainly the awareness piece, which is huge, especially in coaching and just bringing some of those thoughts and feelings to awareness. Say you realize, okay, I have an issue here. What's that first step that people should consider taking?
I typically recommend that folks look at their sleep schedule and sleep opportunity first. Having a regular sleep schedule is not very sexy. I'm going to say it's kind of the equivalent of eat more vegetables when you're trying to look at your nutritional health. But this is something where you really want to nail the basics. And having a regular sleep schedule, meaning you have the same wake up time 7 days a week, and you have the same bedtime 7 days a week, which allow for enough sleep opportunity, is low-hanging fruit when it comes to improving your alertness. And, for most adults, enough sleep is going to be somewhere between 7 and 8 hours. So in order to achieve that, you want to allow for 7.5, 8 hours in bed, because, it's really hard to have a 100% sleep efficiency, which is the amount of time you're sleeping over the amount of time you spend in bed. So you want to allow enough sleep opportunity. I usually suggest starting with the wake up time. The brain very much likes a consistent wake up time, even over a consistent bedtime. So consider, what time would you have to wake up in order to start your day and get the things done, and then work backward from that to identify your bedtime. For those people who have irregular sleep schedules because of work obligations and such, I tend to focus more on light exposure as a way to help sleep when you want and be awake when you want. So light exposure upon awakening is really helpful for the brain to promote awareness and alertness, to have concentration and memory. And then dim light exposure when you want to sleep, on the other end of the spectrum, really helps people to improve sleep quality and shorten the time it takes to get to sleep.
Yeah, that's helpful. I remember rotating through my outpatient pulmonary rotation in peds residency and got to go to the sleep lab and watch as the sleep medicine physicians were reading things. And there were definitely lots of periods of wakefulness. And I think that kind of is really helpful, just to say, okay, start with the wake up time. And at least, and not everyone prefers to be a morning person. I am one of them. Others in my life are definitely not. But yeah, it's about kind of setting some of those boundaries, but like building it up so that you can say, okay, what do I need to get done? What are my obligations? And how do you take those steps forward?
Yeah. I find that outlining things like with really specific action steps is the quickest way to kind of recruit someone to the idea that they can get in control of their sleep. So connecting those dots is really important.
How do you see, just what are some of the struggles with like that dim light, getting the wind down from the day and the use of screens? How has that changed things over the past 10, 15 years?
Yeah, screen time is really pervasive in our society. And I would kind of highlight two things about screens that compete with sleep. One is the light that screens emit, particularly handheld screens, so smartphones, tablets, and laptop computers. And even the dim light or the nighttime settings that you can engage on your screens is not really terribly significant when it comes to reducing the impact on your sleep. So, some people who experience that short wavelength blue light from their screens will actually delay their ability to get to sleep because the brain is quite in tune with light as a signal for wake. So some people delay getting to sleep. Others can fall asleep and they perceive that they sleep. But if I were to magically have an EEG montage on their heads, I would see micro arousals and sleep fragmentation that would probably be connected to that screen exposure. So there's a couple of ways that light can affect your brain. Sometimes it is just difficult or even not something you want to do by taking out your screens at night, but you can manage the light exposure. So, in addition to engaging the night settings on your device, I would suggest wearing some blue blocker glasses. You can look for different percentages of blue blocking, but suffice to say, those that have orange lenses are going to be the highest blue blocker capability. And hopefully, you're not in any fashion shows late at night because it is a little stark to see those orange glasses. But gamers use these, and I think they're really something that I recommend for professionals and other people who do late night screen time and just can't get around it. The other way that screens kind of affect sleep is there's an emotional component to screen time. So, with social media, for example, you're kind of looking for a dopamine hit as you're scrolling. And sometimes there's some agitation emotionally as you're coming up on something that brings you down or lifts you up. There's this kind of emotional response that comes inherent with some screens. Stress is another one. And along with that, the more we engage in screens, the less we're sort of sitting with our own minds and being mindful of our own thoughts. So when you put the screen down and close your eyes to sleep, oftentimes that's the very first time in your whole day that your brain is getting a chance to sit there and be with itself. And asking it to go to sleep in a snap is a bit too much. Our brains are just not designed that way. So, screens are always available. In fact, I kind of joke sometimes. I no longer wear clothes that don't allow me to carry my phone with me. So I carry my phone in my clothes, but I still try to take time away from my screen to be with myself so that all of that time isn't just as I'm trying to sleep.
I think that's really helpful. And before I started my coach training, I was like, just those thoughts and experiencing the feelings and the sensations of like, oh, it's like, this is what it feels like to be hungry or bored. It's just so easy to be like, well, I have a spare moment. Let me pick this up. And then, it's like your emotions, your sleep, what you're eating, like all these things. It's like we're whole human beings. So it kind of all affects each other.
Absolutely right. And, unfortunately, our brains are not evolving as fast as technology. But in a way, that's good because I think, with that awareness, you can put limits on what you're doing. And I've had to do this for myself. I notice that when I'm feeling bored, it's a bit uncomfortable. So to distract, I pick up my phone. And that uncomfortableness then is present at night as I'm trying to sleep. So if I can give my brain space earlier in the day to be bored, and to become less uncomfortable with boredom or lack of stimulation, then at night, it's much easier for my brain to soothe itself and invite sleep in a natural way.
Well, and I found when I'm able to put my phone down for a bit and either experience the boredom or just that opportunity for creativity, I think that has allowed me to be more productive, even as I've thought about topics for podcast episodes or things that I want to do, say, with my family. It's just a different opportunity to engage. How have you seen the effects of sleep and productivity, particularly as you have walked people through just kind of the effects of sleep on that?
Yeah, productivity is something that I really enjoy. So I find it very easy to connect with like minded people that really want to squeeze all the minutes out of their day. But a common sort of maladaptive coping mechanism is to shorten your sleep in order to get more things done. And it's something I coach on a lot because I think it's a bit subtle, but what ends up happening 99 times out of 100 is that compressing your sleep and having mild sleep deprivation just makes the things that you have to do a bit more difficult and it takes longer anyway. So there is a net zero gain. In fact, when you're compressing your sleep, you're reducing your ability to learn. You're also cutting back your creativity because your frontal lobes, the part of your brain that is the new part, the executive functioner, is most affected by sleep loss. And so those neuronal connections, the energy available for things like creativity, innovation, imagination, they are not functioning as well when you're sleep deprived, even modestly. So if you're giving your brain space away from the screens to just play, your thoughts are kind of flowing by, that is really important for creativity. But also, if you are doing that with a well slept brain, then you're likely to see immediate gains in what your brain can produce. Now, there's really interesting research over the past few years about sort of a sewage system of the brain, whereby there's sort of a lymphatic system in the brain. It's called the glymphatic system. And this is something that's very active at night during sleep to clean out all the metabolites produced by the neurons to allow the CSF to cleanse the brain effectively. And if your sleep is crimped or compressed, this glymphatic system cannot operate efficiently, and it effectively constipates your brain from ideas and flow and creativity. So allowing that process to work is likely to give you a noticeable improvement in your productivity if you're able to keep a regular sleep schedule and get enough sleep.
It's really helpful just to hear a little bit more of, okay, the anatomic mechanism, like why this works. But I mean, every part of your body, it's like there's actions that go on and processes. And yeah, to have that opportunity for recharging and like for the body to take care of some of those things, but it just needs that time.
Exactly.
Before we wrap up, what is one piece of advice that you'd have for somebody earlier in their career that you wish you had known back then?
Yeah, I have thought about this, and I think what I would tell my younger self and anyone who's in training or just starting out is to advocate for your own sleep as part of your health and recognize when you're limited by that. Recognize when things are getting dangerous and speak up. It's simply not worth it. Sleep deprivation in its extreme has been associated with seizures, been associated with suicidality. sleep deprivation that's even modest is affecting people's mental health. It's not worth it. You need to speak up. You need to take a break and make some changes. And I would really encourage people who struggle to be vocal and talk about it. I think that things are changing. The more that you're able to advocate for yourself, the more other people understand that they're not alone in these struggles, then we can all work together to improve this system, which is quite archaic in many ways.
That's really helpful. And yeah, even if that looks like, for me, when I was post-call, I would actually go and sleep in the call room from 10 or 11 until 2 or 3. And then I just knew I'd call housekeeping and they'd turn over the room before the next resident needed it. But whatever that needs to look like, to be an advocate, to speak up and to say, okay, things need to change. And whether that's scheduling, which, like you said, some of these things have been around for a while and it may take time, but as we continue to speak up and to encourage people who have the ability to make those changes, I think that'll be how we continue to move this forward.
Yes. Everybody sleeps. Everybody needs sleep. And so I guarantee that if someone realizes they're struggling or they're not safe, the person that they signal to will have some degree of understanding about that. And I would really encourage folks to just think about what tired feels like, know your warning signs, and act on them accordingly.
Well, thank you so much, Dr. Wells, for joining me here on the MedEdWell podcast. And yeah, I think some really great tips and concepts to be aware of for yourself as you advocate for others that you may get a chance to work with, colleagues and trainees. Yeah, this sleep is part of life for everyone. And I want to encourage you to really realize how big of an impact this makes on your wellness and your ability to care for yourself and for others around you. So I want to encourage you to subscribe to the podcast, to share this episode with anyone, with any other physician, or just anyone who you know would really benefit from this. And we all sleep, so that's everybody. So you can change the culture of medicine and promote wellness for your patients, your colleagues, and yourself. Thank you so much for all that you do, and have a great day. And now for our important disclaimer. Dr. Ryan Stedjink is a practicing general pediatrician, but the MedEdWell podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEdWell podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical, or any other specific topic. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEdWell podcast, and have a great day.